I love meeting the people. I love getting to know their stories and their backgrounds and building relationships with them.
The promenade, the people walking, the people talking, facade, what do you want? Believe in my eyes are wide and open. Your ideology better be stronger than the neoliberalism.
So my name is Emily Jackson, and I would just like to tell you a little bit about what I do and what it's like to work in a supervised consumption site. I'm a licensed practical nurse. I also have a Bachelor of Science in Marriage and Family Studies, and I have been working at this SCS for 2.5 years. I started just a couple days after it opened, and I've been here ever since, and I absolutely love it. It's probably the best nursing job I've ever had, and I love that I can incorporate my degree into it and give people a little bit more access to their community and to the supports that they need. We are located within a larger healthcare clinic, which has been very, very convenient because this clinic has many, many supports. So there's doctors, nurse practitioners, psychologists, psychiatrists, social work, there's medical office assistants, the management team is here, and then we have off-site locations. So there's dental clinics, there's a pregnancy program, there's a housing program. We also have housing support workers that come to the clinic. We have an HIV program. We have a program for at-risk youth. We have programs for people who are involved in sex work and need a place to go. We also have a bus that goes around to different communities, and because of COVID, we also have been operating an isolation shelter. I'm sure I've missed a few because it is very extensive, and we have many, many supports, and it is one of the best places to work because of how connected you can be. In the SCS itself, we see a wide variety of people. My youngest client who has come in has been 18 years of age. My oldest has been 82, and they come from all walks of life. Because it is in downtown Edmonton, most of our people are homeless, but we have had businessmen walk in here, so it really takes everyone, stay-at-home moms or people who are working regular jobs. Drug use doesn't really have a classification of people that it affects. I work at one of 3 SCS sites in Edmonton. One is located within a hospital, one is located within a detox and homeless shelter, and the other one is located within a medical clinic. It's great having it located within a medical clinic just because you do have access to so many services, and if someone is seeking treatment, then you can refer them immediately for methadone or Suboxone or any other drug therapies that they need. We also have access to the detox centers so that if we need to refer someone, we're able to do that. We do encourage people to connect to other supports as well. So there's a wound care clinic within the medical clinic as well. We support housing and talking to social workers so people can get medical assistance from the government in order to have more sustainable funding so that they can find a place to live and access to food. We do a lot with food security so that people know where they are able to get some food. We do a little bit with employment training, a little bit with furthering education, and we have a big list of referral resources that we're able to connect people to. A lot of our work within the SCS is building relationships, and that's very important because people will come to trust you more in an SCS than they will in other areas of a medical clinic. So they'll tell you things that they're not even willing to tell their family doctor. And we keep those anonymous unless they're looking for specific additional help, and then we have the power to talk to their family doctor and to other people within the clinic in order to get them connected to the resources that they need. Another one of our main jobs is reversing overdoses. We have reversed over 350 overdoses since we've opened, and that's just a small fraction of the amount that have been reversed within Edmonton because of this. COVID-19 really hit us very hard. there was the same amount of overdose deaths in 2020 as there was from COVID-19, which is very tragic. It was because we had to reduce our capacity, and so there were a lot more deaths from opioids. Also, there was a contamination in the drug supply, so people weren't able to get the purity of the drugs that they had before. Previous to COVID-19, a lot of our supply was actually coming over from China, and now it's being made locally with a lot of different materials that wouldn't normally be seen in the drug supply. So it's been a little bit frustrating, but there's not much you can do because people are going to be using. And one of the things that could be done is to have a safe supply, but the legislation here is not allowing for that yet. As the nurse, I don't inject anyone with drugs, and we do not provide any drugs. We will show someone the steps how to inject safely, and we do provide all the clean equipment that they need so that they can be safe. We don't provide inhalation supplies within the SCS, but the needle exchange program does provide inhalation supplies, so that if that's something they're choosing to do, that they also have safe access to inhalation. So that's a little bit of what I do, and I am happy to talk about it. I love what I do. I love meeting the people. I love getting to know their stories and their backgrounds and building relationships with them. Have a good day. So when people come into the SCS site, they come to this main station at the front here, and this is where they check in. It's quite lovely. They have a nice mural in the background. Right now we are sharing space with a needle exchange program, and that is just because our clinic took over the needle exchange program space to do COVID-19 vaccinations. So this is the Streetworks program. It's a little bit of a disaster at the moment, but it's really good to have a needle exchange site located within the SCS, because then we can coordinate our services and help each other out, and it's been a very good collaboration so far. If you come down this hallway, you can see that there's quite a bit of storage, and we have our drug supplies that we keep here. And then in this back room, there is a consultation room, and I do mental health consultations. If someone has had a really bad overdose, then I will bring them into this room and debrief with them. And then if there are domestic abuse situations or anything like that going on, then we can just bring them back for a private talk. Before they go into the consumption room, there is a sink where everyone can wash their hands, and we do encourage hand washing as much as possible. Any of the artwork you see around the site is either done by clients or staff. At our entrance, we also have a small little library where people can take books. It's getting a little low right now. But what can you do? Coming into the consumption room, we have just closed it for the day, so all the chairs are up, but there are 5 booths that can be used. Before COVID, we had a little buffet where everyone could pick their own supplies. Right now, we are handing out supplies to people to prevent cross-contamination. There's also another little sink in here so that people can wash. But each person goes and sits in their own individual booth. We allow all forms of consumption except for inhalation and smoking, and that is just because we don't have the ventilation for it. It would be great if we did have the ventilation, but it is quite expensive to put in. In the staff area over here, we do have our emergency supplies. So it's a basic crash cart and also oxygen. We do get a fair number of overdoses. We get 2 to 3 a day right now. It can be higher some days. I think the most we've ever had in a single day is 8. Right now, though, the numbers are actually quite high because we're only seeing about 40 people a day because of COVID. In the past, we have seen up to 130 people during a day. There's extra supplies just over here. And then once you're done in this room, you come over into the monitoring space. There's chairs set up so that people can sit down and relax for somewhere. On this desk, we usually have snacks put out so people can have something to eat. It helps with drug absorption, and also a lot of our clients don't have very much food, so it provides a little bit of food security for them. We have take-home naloxone kits that everyone has access to, and you just have to ask for one. We will provide training on how to use naloxone kit. And then there's additional supplies that people are able to take. We also have a washroom, and it's not out of order, that's just on for the moment. A lot of people don't have access to a functioning washroom within the homeless community, so we provide that for them. And then we also provide pamphlets about various topics, and that is the basic site.
Conform for who, conform for what? Yeah, I'm a rebel, I'm challenging everything you got. I can talk to you, don't talk to me. We got some shits to do, don't mess with me. Your ideology